I'm Dr. James Kauten, live in Atlanta, Georgia, work at Piedmont Heart Institute as a cardiac surgeon. I remember in high school, we take driver's education and they show these movies, probably to scare us, but of these terrible automobile accidents. And I remember seeing those and I looked at it and thought, could I be a doctor? Could I take care of these patients? You know, at the time I said, probably not. So I entered into college and got a degree in electrical engineering. And during that course, I became more interested in medicine. I did research one summer that had to do with the blood oxygenators that we use in surgery now. And we got to see some open heart surgery at University of Missouri. And that kind of sparked my interest in medicine. I've been in practice since 1986, so that's 38 years. And I've done over 11,000 open heart surgeries and around another 1.5 to 2.0 thousand transcatheter procedures where we go through the groin and replace valves.
Well, Dr. Kauten's one of the most talented surgeons I've worked with. He runs everything very smoothly. He's very systematic in how he does surgery, which makes it easy to be a scrub nurse for him.
I was involved with a program out of Ethiopia probably about 20 years ago. There was a program in town where they would bring Ethiopian kids into our hospital. They each had to have a sponsor. They would stay with their sponsors for a while. We would look at them, decide how to best take care of them, and then we would operate on them. And then they'd spend about a month, 6 weeks in Atlanta with their sponsor while they recovered before they actually went back home. We would probably do 8 to 12 kids maybe once, twice a year for several years. Well, Mesfin was one of these young Ethiopian kids who had rheumatic fever as a child, was very ill. You know, if he had not had any treatment, he wouldn't be with us today. But he came and we were able to repair his mitral valve.
በ13 ዓመቴ ወደዛ ስወጣና በዚህ ህመም ስታከም ዶክተር ጂም ካውተን የሚባል የአሜሪካ ሰርጀን ነው። አትላንታ ፒድሞንት ሆስፒታል የሚባል ቦታ ነው እኔን ቀዶ ጥገና ያደረገኝ።
I work with Tesfaye. We have a good professional relationship. He would send me his patients, and I would say we sort of started talking. I became interested. I'm on the Heart Attack Ethiopia board. I think it's a really good cause. A lot of good ideas, and we have to figure out how we can change healthcare in the country. Coming here every 2 months and taking care of 100 patients is not going to fix the problem. The waiting list is about 6,000 people, and I mean, you just can't take care of that. Well, I mean, I think part of it is being an engineer. I like to know how to do everything. I see these pictures of the Milky Way, starscapes, and you know, I want to know how to do that. And it's just fascinating to me to take a picture of the night sky. Go to these places. I think the darkest place I've been was Namibia. And we went about 10 miles from the lodge, kind of went around the corner by these dunes, and it was so dark you couldn't see the hand in front of your face. The guide and I spent a couple hours taking photographs. I'm into technology, and I like to know how things work and how to take photos. And there's a lot more things I want to explore in the photograph world. And I think being an amateur, I could do that. If I was a professional, I'd have to focus on what I do and make sure I do it perfectly every time, like you. And but I just kind of like being able to do all these things. I don't know anybody who, except some of the people who have seen my photos, who have then gone and taken some photos of the Milky Way. It's just, I like looking at my photos at home, and In my office at the Marcus Heart Valve Center, I have 64 of my photos hanging up in the office for the staff and patients to enjoy.